Hey, I'm Dr. Dino Pappas. This is manual therapy for the overhead athlete. I'm going to show you a couple of these simple things that I do for some of the most common deficits that I see in the overhead athlete. So let's talk about the pec. The pec minor runs right here from the breastbone along the second, third, and fourth ribs and attaches right here into the front of the shoulder, right to the coracoid process. In order to get a good release, relaxation of tissues, I use three strategies. The first is a PIR. So let's say if you get a little bit closer to the edge. And what we do with this position is I have them roll their shoulder, so the shoulder rolls forward. I also have them anterior tilt, and you resist that. So bend your elbow here just a little bit. I want you to roll your shoulder here just a little bit forward, and I have them resist. Again, 10 seconds, 9, 8, 7, 6, 5, 4, 3, 2, 1, relax. And you retract. Go ahead, no, relax. I have them retract and I posteriorly tilt. Go ahead and protract, push that forward and roll that forward, good, and resist. 10 seconds, deep breath, relax, retract and posteriorly tilt, and that's for the pec minor. The next is a release maneuver, scoot more towards the edge. I like using them at the end of the table, and I usually will come in right through the armpit and I'll get right at the coracoid process. I'll retract the shoulder and I will posteriorly tilt that. As we do that, we're getting relaxation of the attachment spot for the coracoid process coming back in. Remember that the pec minor sits underneath the pec major, and that helps me strip through those fibers. The last thing is just a positional release. Well, I'll just hold that steady pressure right here in a position of retraction and posterior tilt right through there, or right in that position right there as well. Okay, and that's for the pec minor. The next, scoot over just a little bit, is the pec major. The PIR, which is gentle relaxation of these tissues, has the arm in this position. And what the pec major does, it brings the arm closer to the midline of the body, and I'll just resist steady pressure from this position. Good, about a 10 count, so let's just say 6, 7, 8, 9, 10, deep breath, and relax. And I don't force the elongation, I just let that happen naturally and take that to the new barrier. Typically do that between 3 to 4 sets of 10. The next is a pin and strip maneuver where I'm actually on the pec major up through here, and I'll lengthen in this position several passes. And the last major thing that we'll do besides is just a positional release. We'll hold the arm in this position. I'll hunt around and try to find tissue tension, tissue restriction, and just try to release already in a lengthened position. Going on your side, please. The lat. Lat's actually an interesting muscle since it spans quite a bit of the body. It actually connects and goes here into the anterior part of the body. And I found the best way to get relaxation, gentle relaxation of the lat, is to have them in the side-lying position with the arm in the overhead. And I will say, bring the elbow and the pelvis together. So I want you to just hike just a little bit up here and bring the elbow together. Same thing, gentle, 20-30% pressure. Hold it for a 10 count, 6, 7, 8, 9, 10. Deep breath, relax, get a little elongation, taking this to the next barrier. So we're getting a little bit of a stretch right here in the shoulder and on the side right through here. I usually recommend 3 to 4 passes of 10 seconds or whatever what's needed to generate the desired effect. Next is a pin and strip maneuver. Well, I have my finger right on this area and I'll actually lengthen this a little bit more aggressively. I'll get into the fibers of the lat as we get right here near the scapula, as we get here into the back of the shoulder. You can get this from a side-lying position. You can angle it so the arm's a little bit more of a scaption. You can even do it if you feel the tissue restriction and a little bit of flexion. So you can get it from multiple positions in this area right through here. The last is more of a positional release, and usually I'll find the upper third of this lat that will most impact the shoulder. I'll just hold this from this and get me more of a positional release from that position right through there. Okay, let's go ahead and put you on your back. Let's talk about the external and internal rotators. So let's talk about the subscap. The only way to access the subscap is to come in through the armpit, and you have to warn your patients that this will be uncomfortable. So I'm going to hook into the subscap from this position right through here. The PIR for this position is go ahead and resist internal rotation. Make sure that it's GH motion the GH joint, not the scapula. So you literally try to lock the scapula in place. Go ahead and push up and in. Again, 10 seconds, 7, 8, 9, 10. Deep breath in, breathe out, and take it to the next barrier to generate that external rotation and release the subscap. The pin and strip where you hook in and will internally and externally rotate. This is often a little bit uncomfortable for that patient, finding it out. And the last thing is a positional release. I'll find 1 or 2 tight areas, and I'll just hold it in that position until I feel the release, and then generate the next a little bit more and a little bit more. Let's talk about the internal rotation of the arm. So I'll block the scapula right here, so I just get pure GH motion, or as much as possible. I'll have them push all the way out. This is a PIR generating internal rotation. Again, use my 10 count, 7, 8, 9, 10. Breathe, relax, take it to the barrier. Again, I'll do about 3 to 4 of these for about 10 seconds, and I'll retest internal rotation of the arm. For working the tissues, this is working at the infraspinatus right here in the back of the shoulder. This can be done in a sitting position or laying down. If the patient is laying, actually I have them do it sitting up, face out towards the wall. I'll hold this position right through here. I'll have them internally and externally rotate from this position, or just bring the arm back behind their back. Go ahead and pull it with the opposite arm. And then I'll have them tilt their head and neck to the opposite side, and we will generate a little bit of release of this infraspinatus right through here. Okay, all right. The last major thing that we'll work on from this position is the posterior capsule. Usually I have them doing in a sitting position. Here's the posterior part of the glenohumeral, right? This is the ball. As I come right down and in, I'll drift into the posterior capsule, bring the arm across, go ahead and pull that with the opposite arm. We'll get a little bit of work of that posterior capsule. You can also have them get a little bit off of it, right back into this position, work that. Or bring the arm into internal and external rotation. Go ahead and follow that up and then down. Go ahead and just lock in and really just loosen that tissue up with a little bit of motion. Let's talk about some general mobilizations. Let's go ahead and put you on your back. One thing I've found to be pretty effective for glenohumeral mobilizations is using this mulligan belt, this mulligan strap that helps me get good distraction, good pull on the shoulder joint. So I'm going to put this up into the shoulder and into the armpit. I'm going to take my foot down here, and I'm going to generate a little bit of posterior glide. This is posterior gliding the shoulder. From this position, you can glide inferiorly. You could also just pull a little bit laterally if you so choose to add some decompression, whatever your assessment tells you. So I'm going to go with posterior straight down to the floor and a little bit of inferior glide. The arm can be up on a chair, or it can be on top of my knee. If it's on a chair, it's going to look something like that. And as I generate pressure with the mulligan belt, posterior glide, inferior glide, I'm just rotating the joint into the resistance. From this position here, I like to do between 2 to 3 sets of 10. For the most part, it should be mostly painless internal rotation with the glide of the shoulder joint. Always check with the patient. Again, in the mulligan concept, mostly painless movements are what are preferred. Again, retesting our baselines before and after. Likewise, we can generate external rotation the same way. We can glide posteriorly. Again, use my belt to generate some distraction, posterior glide. I can generate inferior, I can separate, I can go lateral, pulling lateral, and same thing, I'm generating external rotation of the shoulder joint, which she does not need, but again, this is just for visual effect. Again, stepping down here, generating that glide. The last thing, let's have you on all 4 on top of the table. Let's have your arms in the overhead position. Good. And what I want you to do, let's get the arms up overhead if you can. I want you to rock back so your heels are going towards your buttock. Good. So the shoulder is going into flexion. From this position, let's have you go back. Let's go forward to the start position. We can cup the front part of the shoulder and cup the scapula. We can generate posterior tilt and protraction from this, assisting the scapula to, again, protract, posteriorly tilt. Go ahead and rock back. We also can generate a little bit of external rotation of the shoulder as well. Again, this is a mulligan style mobilization. Usually 2 to 3 sets of 10 are recommended. We can change the arm position if we find in our assessment by having our arms go a little bit wider. This is more, instead of flexion, the scapular plane. We can also now assist a little bit more in this position of upward rotation of the scapula as well. So I'm going to posteriorly tilt, I'm going to upward rotate, go ahead, and you can generate that motion of the scapula right through there. About 2 to 3 sets of 10 is what's recommended. I'm Dr. Dino Pappas. This is manual therapy for the overhead athlete. This is just a small tidbit of what we can do in the office. Thanks.